Hello, this is Paulet Downey, and I'm back again with a skincare minute. So, this segment is going to be on rosacea and the products that are out there to care for rosacea. So, I'm going to start by talking about what rosacea is. So, rosacea is a genetic neurovascular disease. So it is a progressive disease. It is mainly found on the skin of those who are Caucasian and are very pale in complexion as well as light hair. But that's who it is mainly seen on. You also have Caucasians who have warm skin tones who are affected by this disease, as well as Asians, as well as some who are of Middle Eastern descent, and you even have some people who are of African descent who suffer from this, but these are all in smaller numbers. The majority, like I said, is Caucasians who are very pale in complexion and tend to have like light hair. So it is, like I said, it's a neurovascular disease. It shows up primarily in the center area of the face, so normally on the nose, around the cheek area, chin, and forehead. It is progressive. What happens with this is it flushes like with red. So like it's red around those areas that I mentioned. So the stages, the progressive stages of rosacea, I'm going to talk about all of the stages. So the first stage is the mild stage. So at this stage, what happens is normally it happens from like exercising, warm weather, cold weather, spicy food, embarrassment, anger. So as a result of people who have this disease, when they are dealing at the mild stage of rosacea, the skin will become red. Within half an hour after those emotions or whatever elements are coming at their skin happen. So once this happens, then it takes several hours or at least days for that red flushing to go away. So the skin, like clients have usually talked about with me, usually it's feeling very irritated, very dry, itchy, inflamed, and very sensitive when it comes to skincare products at this stage. The redness that occurs around the area, and like I said, it could last for several hours, normally 24 to 48 hours, sometimes longer, but it does eventually go away. So it is a temporary flushing of the skin that goes away. But if this is not taken care of at this stage, if proper care isn't taken at this stage, then it is going to progress into the so there's the mild, and then there's the moderate, and so it's going to go to the moderate stage. At the moderate stage, this is where things become a little more permanent. So again, the same areas that I mentioned, but what happens then is that's when you're also going to see like more permanent, like the changing of the skin. So the redness that you will see around those areas tend not to leave. They are then accompanied by papules, pustules, dilated capillaries. So you're going to see all of this at the second stage, at the Yes, so there's the mild, more moderate stage. So a permanent color of redness begins to show up on the skin. It doesn't leave at this stage. And so at this stage, a lot of times what happens is people mistaken it because of the papules, because of the pustles, people mistaken it for acne. So I know, like, I've had a couple of customers who actually went to dermatologists. Like, this has happened, like, actually more than twice, but where my customers, they've gone to the dermatologist, and the dermatologist determined that it was acne. And so they determined that it was acne, and they gave them cortisone steroids, like the injections of cortisone, in the papules, in the pustles, when in fact it was rosacea, and then the skin just got worse because of it. So I mean, like I said, these customers, they came to me, with their story and everything. I mean, I could see clearly that it was rosacea. I'm sure many dermatologists out there know when they are looking at rosacea, the difference between acne and rosacea, because although there are similar characteristics, there are still differences between the two. So it was really horrifying to see, my customer's skin and the state that it was in, simply because of the cortisone injections that they received, because of the dermatologist mistaken it for acne, when in fact it was rosacea. So I recommended them a few products for rosacea. And I had one customer come back in a week and say, "Oh my goodness, can you see the difference?" Like, in 1 week, because of the products that I recommended her, it cleared up immensely. So it is very important to make sure that when you have rosacea, to make sure that you are not treating it as if you have acne, because that is only going to inflame the problem and increase it. And then it's going to take it to the next stage. And so the next stage here, we're dealing with enlarged blood vessels, disfigured facial contours. So basically the cheek area becomes more disfigured, the nose becomes more disfigured. And you know about like some men, because this is something, normally it happens with men. So there are some women out there with the nose and more with the cheek area. I find when we're at the advanced stage of rosacea, but the blood vessels in the nose are enlarged, and even around the cheek areas, everything just becomes much more enlarged. The skin becomes more disfigured, and this is permanent. And this is permanent. Of course, there are treatments out there, and I'm going to talk about those in a moment. But if it is not cared for when it's at the second stage, it is going to progress into the advanced stages that I am speaking of right now. And so, like I was saying about the men, so they have that bulb on the nose, and a lot of times you look at it as excessive drinking, as men who drink excessively, and as a result, that's why they have that bulb sitting on their nose, when in fact, in many cases, it is rosacea that you're looking at, and you're looking at rosacea at the more advanced stage. So there is treatment, but this is permanent. And so, but I'm going to talk about that. So if it is not treated at this stage, if the skin, if nothing is done at this stage, then it moves on to the fourth stage, which is severe, and that's ocular rosacea. So again, this is something that predominantly happens to men, and it happens in the orbital area of of the eyes. And so what happens there is it becomes like the blood vessels, of course, increase around there. It becomes very gritty. Lashes start to fall out. Bumps start to form around the lashes. And it could cause blindness depending on the severity and how long it's left not cared for. So those are the 4 stages of rosacea. Now, how do we care for rosacea? What is out there? What are the treatments that are out there? What can you do if you are suffering from rosacea? So first of all, like I said, I gave you the characteristics of rosacea and how it differs from acne. It can look like acne, especially when it's going into the 2nd stage. But one of the main differences between acne and rosacea is the staining of the skin. So the staining pinkness or redness of the skin, something that you are not going to find with acne. With acne, you're just finding papules, pustules, nodules, cysts. You're just dealing with the actual pimple. Whereas with rosacea, you are dealing with you're dealing with the staining of the color of the skin. You're also dealing with dilated capillaries and the enlarging of the blood vessels. So these are the characteristics that you are not going to find if you are dealing with strictly acne. Yes, it does show up predominantly in the areas where acne shows up, especially for those who are younger, in the whole sebaceous area where it is more predominant, the T-zone area, but as well as the cheek area. With rosacea, you'll also find it in the chin area as well. Depending on the stage. Even at stage 1, you will find it in the cheek area or in the chin area as well as the forehead. So, so anyway, so how are we going to care for this? So I gave you the characteristics between the two. Make sure to speak to a dermatologist about this, this disease. Before taking it into your own hands. And so so for like going to a dermatologist, receiving any kind of, like advice from the dermatologist, there, of course, there are prescriptions that are available for rosacea. There are the vitamin A derivatives, the Renova, as well as Metrogel. So those are vitamin A derivatives, as well as azelaic acid, which is basically, it helps. So the azelaic acid, of course, is going to help with getting rid of the bacteria, as well as sloughing off any kind of dead skin. Renova is going to do the same. Renova is going to be a little more strong to the skin. And with the Metrogel, it's going to work as an antibiotic, and it is also going to provide moisture to the skin and help with the inflammation that occurs as a result of the rosacea. So these are just some of the medications that are out there. So these are topical medications that I'm talking about. There's also topical as well as oral medications as well, especially when we're dealing with the eyes. So we have steroid eye drops, which are for the ocular rosacea as well. And also when you're dealing with the more moderate to advanced stages of rosacea, then you are going to you may need to look into using topical / oral care, a medication to help with minimizing that and keeping it in control. So there's also surgery. So the surgery would be for the nose, and that would help to bring down the enlarged blood vessels that are on the nose and around the disfiguration of the cheeks. So that's going to help with that. There's laser for that. There's also electro surgery for that case for the nose and the cheek area when it becomes disfigured. Uh, so so that's it from a medical, like when you are seeking out the advice of a dermatologist, and you should always seek out the advice of a dermatologist when you do when you think that you are dealing with rosacea, even with acne, especially at its more for acne at its more severe level. When it's more like moderate to severe with acne, it depends on where it's at. You can actually speak with your medical skincare therapist or your esthetician regarding that. But when it's but for rosacea and a severe case of acne, then of course you are going to want to seek the consultation of a dermatologist to see what they have to say. But like I told you, there have been some cases where dermatologists have mistaken rosacea for acne. So by you knowing the characteristics of acne versus rosacea, you can avoid having certain surgeries or injections that are just going to complicate and make the disease or the stage that you're at worse. So take that into mind. So now at a so for dealing with a medical skincare therapist or an esthetician, as well as a dermatologist. So for all three, you can there is lymphatic drainage. So lymphatic drainage is basically a massage technique. So this massage technique basically it removes the stagnant liquids that are in the skin. So moving those to the lymphatic vessels, and then from the vessels, it's going to the lymph nodes, and then after it goes to the lymph nodes, then the lymph nodes are cleaning it up so that it can flow through the skin nice and clean. So this is basically like a detox. So it's a detox for the skin. It's a detox for the skin. And what it is doing, it is bringing nutrients to the skin. It is helping with the cellular turnover in the skin and helping to, regenerate cellular movement in the skin, causing the blood that is stagnated in the area to flow more smoothly, allowing the pooled, the blood that is in those areas to spread out. So that's what lymphatic drainage is doing. So it's basically a detox, and it really works. It really does work. It's a really excellent thing to have done. And so, like I said, you would go to your medical skincare therapist or your esthetician or a dermatologist to have this procedure done. At the dermatologist level, depending, they probably would have a medical skincare therapist or an esthetician on hand who would do that. That's not something that they would do, but it's something that they would have in-house depending on where, like how their office is housed. Also, IPL. So that is something that is done at a medical skincare therapist level, esthetician level, and a dermatologist level. So that is it is a device. It's basically a skincare device that helps with, again, with lymphatic drainage and with the removal of stagnant fluids that are in the skin. And this is also an excellent way of helping to keep the skin at bay, keep it from progressing into the next stage of the rosacea level, and and actually helping to reduce the amount of redness that is showing up in the skin. So when you're taking these kinds of steps, it's best to catch it at its early stage. Like if you can catch it at its early stage, that's the best thing to do, because this is a lifelong treatment. So if you catch it at its early stage, there's nothing you can do to get rid of it. This is a genetic disease, and there is no cure for it. But it can be kept at bay, and you can minimize the appearance of the redness by taking, certain precautions, be it through massage, be it through devices that are out there, skincare devices, or skincare. So it is best to catch it at its early stage so that it doesn't progress into the second stage and then into the more serious stage of the advanced stage and then the severe stage. So the earlier you catch it, the better it is for you. As for and with the medical, and this is something that your dermatologist would speak with you about if you were getting medicine, prescription for the medical, like the ingredients or the medications that I mentioned, you would have to use sunscreen. So these, like a couple of them that I mentioned, all like even with the azelaic acid, you are going to need to use sunscreen. You're going to need to use sunscreen to keep the skin from becoming raw, and also to help with healing any kind of inflammation, any kind of scarring that may have happened as a result of the rosacea. So with over-the-counter products, there are amazing over-the-counter products that will help keep your skin in tip-top shape and keep rosacea at bay. And so, like I mentioned to you, I had a few, and I had many customers throughout the years who suffer with rosacea, many. And like I said, I recommended certain brands to these people, and these brands, the ranges from these brands have proven to be so effective every single time. So I am, just like I did with acne, I feel that I should mention a few of these brands that are out there that are really good with really reducing the redness that shows up in the skin, also helping with decreasing the papules, the pustules, the inflammation, the itchiness that accompanies skin that is affected by rosacea. Pierre Fab, that whole beautiful umbrella of brands, which consists of Avan, Ducray, and then there's a whole bunch of other brands under that umbrella that produce really good products, especially made for sensitive skin and people who are suffering or who have rosacea. And so they have proven to be effective time and time again. La Roche-Posay, another very good brand that really helps with dealing with rosacea, and Uriage and Bioderma. Again, these are all dermatologist tested brands. These are brands that you are going to find in the derm area. You are most likely going to find them in a drugstore. I know that there are some department stores that sell some of these derm brands that I mentioned, but these derm brands, of course, are are products that you are mostly going to find in a pharmacy or a dermatologist setting. And so these brands, great ranges for rosacea. Time and time again, they have proven to be very, very effective. Like I said, had a couple of, or even a few, who have gone to dermatologists and mistakenly, the dermatologist said that what they were dealing with was acne when it turned out to be rosacea. And so when I recommended, because I could see that it was rosacea, to me it was clear that it was rosacea, so I recommended products to them to help with the rosacea, and their skin cleared up. They had to keep using it, of course, because in order to keep it at bay. But these products really do work. I know there are other ones. There are other brands out there in the derm section. These aren't brands that you're going to find in prestige because this is a disease we're talking about. This is something that is going to be under the derm umbrella. And that's basically what I have to say about rosacea. Remember the characteristics of rosacea. Just remember the characteristics and the difference between rosacea and acne. So you're not going to go out there and buy products for acne. Because there are products that are suited to rosacea, as well as certain ingredients that you should be using. For anyone, of course, who is thinking about getting any kind of lymphatic drainage massage, which is really good, and I would recommend it to people even who aren't suffering from rosacea. There are contraindications, so of course, whoever you are going to, the professional who you are going to seek out, be it a medical skincare therapist, an esthetician, they are going to advise you of the contraindications that are involved. So you have to make sure that you don't fall under that in order to be able to receive any kind of lymphatic drainage massage. But if you don't fall under those, it is an amazing massage to have to alleviate the redness that is showing up in your skin. So now that's it for this segment of a Skincare Minute. And until I speak with you again, take care.